A 25-year-old woman who has just delivered an infant has painless vaginal bleeding refractory to uterine massage. IV oxytocin is started and bleeding slows down. The vagina shows no laceration. Placenta inspection shows that it remains intact. The likely cost for postpartum hemorrhage. So A is placental abruption. B is impaired myometrial contraction. C is retained products. And D is uterine rupture. So I'll let you answer the question and then I'll explain. Okay, so the answer is going to be B, impaired myometrial contraction. So in this case, what we have is uterine atony. So essentially what happens is the myometrium is supposed to contract after after delivery of the infant. And this is because when the myometrial contraction occurs, the spiral arteries of the uterus contract. And so when that happens, you have less blood flow. Since there's a lot of bleeding involved during delivery, you want the blood flow to decrease to the uterus so that way you don't have a complete hemorrhage and hypotension of the mom. And so the first line treatment is going to be massage. When you massage the uterus, that's going to lead the uterus to contract. So ideally that constricts the spiral arteries. But if that doesn't work, you can actually give oxytocin IV, and then that can actually go ahead and stimulate the myometrium of the uterus to contract. And so that can be a good second line option. And so just going over the other choices, we have placental abruption. So this typically occurs in the third trimester. You typically have painful contractions, which is different from this case, where you had painless contractions with vaginal bleeding. So the difference is pain in this case. So that's why it wouldn't be this answer. And then the other answer choice was retained products. So in this case, that's not the case because we have a placenta, and when it was inspected, it was completely intact. And this is actually what you do during deliveries. You also deliver the placenta, and then you check it thoroughly to make sure that it's completely intact and that there's no pieces missing. Otherwise, you will have to go looking for the pieces to make sure that it doesn't stay in the uterus, because that can end up causing problems down the line and can become septic. And so the last answer choice is going to be uterine rupture. So just like the name implies, what happens is the uterus has a tear in it. And so this is clearly a problem because you'll need to sew it up, and that can lead to more bleeding. And so the risk factors for this are just going to be anything that can weaken the myometrium. So for example, if you had multiple pregnancies, that's going to weaken the uterus. If you had a C-section, that's also going to weaken it because you've had a previous cut through it. So all these things can weaken the uterus and lead it to uterine rupture. And so going back to the question, so for this, you just had to recognize the clinical picture of uterine atony, which is going to be painless vaginal bleeding, and then they give you the other clues of having an intact placenta and trying to first do the uterine massage and then giving IV oxytocin, which ends up solving the bleeding. And so that's how you answer this question. I hope that helped, and thanks for watching.